Coverage right now. There's a claim tonight that the overwhelming increase in patients is leading to a shortage of masks and other items doctors and nurses need.
Yeah, some nurses are claiming that they're having to share that equipment. CBS 13's Renee Santos joins us live now outside Kaiser Medical Center in Manteca with a story you'll only see here on CBS 13. Renee.
Yeah, I spoke to a nurse who says that he showed up for a shift here at the Manteca Kaiser and there weren't any masks. He says he had to get one from another employee because it was his only option. Meantime, Kaiser says all staff are provided their own mask and are managing supplies.
When we are driven the way we are and short-staffed the way we are and not given supplies to keep ourselves safe, it definitely is stressful.
Emergency department nurse John Cole almost in tears describing what he says these past few months have been like. Hospitals stretched thin, PPE-like masks he claims are being rationed.
These masks were designed to be disposable, but they're so concerned about getting in trouble that they're basically reusing their PPE for weeks at a time.
Just recently, he says, while picking up a shift at this Kaiser in Manteca, there weren't any masks for him to use.
I had to basically get a mask from another employee that they had to protect myself.
CBS 13 reached out to Kaiser, who denies staff sharing masks and says all employees are provided their own. They say they do use new N95 masks and extend the use of them with safe decontamination procedures set by the CDC and FDA. And tell us with the continued nationwide shortage, they are taking action to ensure staff have the right level of PPE to safely deliver patient care. Meantime, new numbers from San Joaquin County show right now 25 beds are being used at Kaiser in Manteca. Vida Tan works at Kaiser in Modesto.
For the first time in my 32 years of experience, now I have that great concern that I'm not able to do the highest level of care because of the concerns that we have.
She worries about staffing, exposure, and PPE supplies just as much as John does.
On a personal note, probably getting it and bringing it home.
Now, Kaiser also adds they do ask staff to conserve equipment in ways that are safe and government approved. They say they are managing PPE supply to ensure that they have the adequate availability for staff.
All right, very interesting. Thanks so much, Renee.